Well, hello everyone. Glad you could join us tonight. We got an interesting set of video clips. I think you'll enjoy. And just want to mention, in case you didn't hear about it last week, but we did have a winner for the month of February. That was Vishnu Manoon. And so congratulations, Vishnu. I know Vishnu has already received his product, so I think everything went well. So please remember to visit our website, and you can get all sorts of information. That's www.SunPowerLED. Especially if you go into the either past videos, you can see ones that we have done, older webinars, but there's a lot of cool people that I've been able to interview over the years. Well, I guess it's just over 2 years now. So we've been doing that for this long. And so actually it went even further than that, I guess. But the last recordings anyways for the last two. So we're going to get started right away. We're going to do our just intro, and here we go. PBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's the sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have two different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can. Okay, so tonight Tonight's topics are brain health, dental health. We'll be talking plantar fasciitis, and we have Dr. Reem Hanna, who I met in England, as well as Dr. Praveen Arany, and I have worked with him for quite some time, and Dr. Terrance Baker, and Dr. Seiden, and Dr. Gerry Ross, all on tonight's video snips that we have. So here we go. Okay, no, don't.
This is what happens when you fall asleep. Right away, you should have cerebral spinal fluid, which is dyed green here. It's not green. But anyway, it comes in and it starts massaging the vessels to get rid of these protein deposits. And in fact, the first complaint from almost anyone with dementia, Alzheimer's disease, or the football players, they say, I can't sleep. I cannot sleep. Well, they can't sleep. And so we have to get rid of it. They've got too many protein deposits in there. Tau in the football players, beta amyloid and tau in Alzheimer's disease. So many people are now suggesting when you do your photobiomodulation, do it at night, just before you go to bed, because you want to vasodilate that. And very quickly, this is Anita Saltmarsh's study. She had 5 cases, and I wanted to point out their age at entry. They are from age 72 to 90, and she's going to get significant results in all 5 of them. And this is the mini mental state exam here. It's, again, I mentioned it before, there's 30 questions, what day of the week, what month, and so on. And these are the moderate severe ones. They could only get 10 out of 30 correct, and the others are 21, 22, and 24 correct answers. She treated the default mode network, as I said, in her office twice a week for 2 weeks, and then only once a week for the next 10 weeks. But every day they didn't come in the office. They used a separate intranasal LED, 810 nanometer, to get up to the olfactory bulbs and then ultimately to the hippocampus.
So this is Dr. Margaret Naser on here, and she has a wealth of knowledge, and I'm saddened to say I didn't mention her name, but I've been able to connect with her and work with her. She's a phenomenal doctor from Boston, Massachusetts. And and she was able to present as well about the concussion case study that we had at our location.
So I showed you this before, and as soon as you take the equipment away, they plummet. And it was the same thing for the Alzheimer's disease assessment scale. And she has nice anecdotal information she'll talk to you. We'll talk to you about that later. And this is one of the patients I just think is fantastic. When she came into the study, she could not cook. She had decreased ability to cook, wasn't interested. After 12 weeks, she came in able to give a recipe to the assessor by memory. And then, but after they took the equipment away, she cooked and cleaned less and less. They just need the continued treatments, and that's how they can cope with their depression. With their Alzheimer's disease. And this is the second study with similar results. Linda Chow in San Francisco, she's going to treat with this V-Light for the the default mode network. And here on the left, you can see the blue is the photobiomodulation group, and lower scores on this Alzheimer's disease assessment scale is better. It's highly significant reduction. And this is the neuropsychiatric inventory. And this is also highly significant. UC is usual care. They didn't do anything, no treatment. Maybe they were taking donepezil or some other medication, but they just continued to get worse. And she did find increased functional connectivity in the posterior parts of the default mode network after that treatment. And then some of them who, 3 of the cases in the usual care group that really weren't getting the treatment were switched over after the 12 weeks. And you can see as a group, they went down. This is great that their ADAS-Cog lower scores are better. And then somewhat on the neuropsychiatric inventory, I don't know what happened there. But they did better, and they were grateful to have that. So the last slide, increase in ATP, blood vessel dilation, lymphatic vessel dilation, salience network, very important. You remember that anterior cingulate gyrus. And the NAA, the N-acetyl aspartate in anterior cingulate was present and increased at week 1 and week 6. This is very important for their cognition and reducing PTSD, and increased brain-derived neurotrophic factors, serotonin, melatonin, with improved sleep and reduced inflammation. So
later on, we started using the helmet, and of course, cognitive issues were a problem. Besides the hallucinations and the dream sleeping, his memory was quite bad. But when he started using the helmet, there were very noticeable changes over that period of time. He started in about January, so now it's just over 2 months he's been using it. And some of the things that were obvious were his alertness, awareness of what was going on around him, because at times he didn't even recognize us. Memory. One of the tasks he would do around the house would be unloading the dishwasher, and I would find dishes all over the place in different cupboards. But,
oh, Alan, you were giving Flo a real good challenge, weren't you?
She
can eat no fine.
But I noticed that once he started using the helmet, that his memory improved drastically in that area. His memory for people and events and dates, because before he couldn't remember any dates that were coming up or any people that he had talked to, but that improved drastically. Interpreting language, like you would say something to him and he would hear the words, he would hear them, but his mind wouldn't really comprehend what they meant. But and so you'd often have to say it 2 or 3 times. But that has improved drastically. One of the other things is being able to focus and stay on topic if there is a discussion, because before he just could not stay with the topic or stay focused on anything. The dream acting has almost entirely subsided since he's been using the machine.
I'll tell you one that just to interrupt you for a sec that you got to laugh at. One time I got slugged right in the chest, and Monica, she says, "There." She let me have it. Good thing it wasn't in my face, but thankfully that hasn't reoccurred. But I don't know about every night having somebody acting out their dreams. That would be pretty tough, I imagine.
Well, I was more concerned about him falling or
going downstairs.
Well, he did end up going outside one night, and I'm usually a light sleeper, but I had moved to the other bedroom because of his acting out and didn't hear him leave the house.
Quiet as a mouse, huh?
And the thing is, when he is acting out his dreams, he doesn't have the same physical limitations that he has normally. Normally, when he's just barely making it up and down stairs, he can go up and down the stairs as though there's no pain or disability.
Wow.
Yeah, when he's dream acting, he doesn't seem to be aware of any pain or discomfort or disability. It seems to be in the background. Anyway, his sleeping has been much more solid and undisturbed than it ever was. I had a camera in we moved his bedroom to the main floor, and so I have a camera there that alerts me every time he moves. And so I can keep a good check on what he's doing. And many nights he seldom moves at all except to change position in the bed. And so it's made a big difference.
Another huge topic that's coming up, and I think Tom may address it because he's actually working on a helmet for some of these things, is some of the degenerative brain diseases. Parkinson's, MS, Alzheimer's, they're all being researched with PBM. In fact, right now in Hamilton, Ontario, there's a study going on. I'm not sure if it's totally filled now or not. So if you've got relatives, I can find out if they've got their full complement of patients or not. But they're studying Parkinson's patients. What they're doing, it's a study that was first done in Australia, and they're trying to repeat it here for Health Canada approvals for Parkinson's treatment. So what they found in the study in Australia is they took patients with mild to moderate Parkinson's disease, and they did the light on it 3 times a week, and they also did some exercise with the patients. And what they found was the patients that kept up with the PBM treatment, their Parkinson's over a 3-year period remained at that exact same level. It didn't, they made some slight improvement, but you're not fixing it, but there was no deterioration. Whereas those, if you had no treatment over those 3 years, those patients would have deteriorated a lot. So, I mean, this is a very exciting study for the Parkinson's, because Parkinson's is a huge thing. In fact, all the degenerative brain diseases are becoming more and more prevalent as we age.
There have
keep going.
been several reports on the efficacy of photobiomodulation for Parkinson's disease, right? These are patients with tremors that unfortunately are limited to what treatment they can avail. And it has been shown very effectively in animal models that when you inject a toxin and create Parkinson's in the animals, you can reverse all the effects by using light. So a couple of people in an Parkinson's clinic saw those reports in the literature, and they said, what's the big deal, right? We can just buy LEDs and do this treatment because it's just light. And believe it or not, they actually put lights in a bucket and they put it on their head for the treatment. And this editorial was actually written in response to that, saying that it is easy to do. Anybody can use different kinds of light devices and do the treatment. The trick is how good is that device and how good is the protocol, right? And we don't want to offer 50% or 70% treatments to our patients. We want to use at least 90 to 95%, right? And that is defined by how good the device is and how good the protocol is. So that image was actually, it was a bit of a call out to that paper, the buckets paper, which is believe it or not, a scientific paper. So if you look up the term buckets paper and light treatment for Parkinson's.
Yeah, that was earlier, the person with the Lewy body dementia. That's a good friend of mine, Alan McGraw. And there's a much longer segment that we have of his recording of how he actually comes on and speaks for a while. And he did extremely well. And it was pretty neat. But we've also been able to see right now two people locally with Parkinson's, and 2 people in Detroit that have seen that part with Parkinson's, and all 4 have significantly improved with the use of the light therapy, the helmet. And we're talking mid-December when they started, and to have such an improvement even within a month. As a matter of fact, the one patient after the very first treatment before that, he was falling many times during the day. And after the first treatment, he no longer was falling. Taste and smell coming back after one person after 4 years, another person after 20 years, taste and smell returned. The ability to draw an analog clock, with the hands on it and put the numbers all the way around, totally gone. Not able to do that. Not even able to draw a circle, back to drawing a clock with the hands in place and numbers, and being able to even tell the time from there. One of the persons that was really good in accounting and could no longer calculate anything to do with numbers. And then they went out to eat, and he was able to figure out the tip for the waitress. So, the ability of to be able to have brain cognition, where you can actually start thinking again, also was pretty neat. We do have another testimony of a person that this one person that I mentioned of the 4 Parkinson's, that his wife said he's the first time he was able to smile in years, because he could not, that part didn't work anymore. I guess it's called Parkinson's mask, was what I was told, where you don't have any emotion left. And on the video where I do the interview, I cracked a joke and he laughed. So it's pretty neat, because, to be able to think things through. So now we're going to go on to the next thing, talking about, well, I'll let it play. Here we go. Will the POM 1050 help with chronic plantar fasciitis that hasn't responded to laser shock therapy? I can tell you that one of the individuals that's a politician of one of our in Canada had fully recovered from really bad plantar fasciitis, and he was a runner and couldn't run and wanted to run the marathon, and ended up using the light on the Super Palm 1050 on his foot, and blew him away that he was able to go and re-enter for the marathon, and was able to do a half marathon. We have them posted on our website that totally turned his foot around. Your comments to things like plantar fasciitis, Dr. Baker?
It's very effective. Very effective. We've had golfers, professional, near professional golfers, and tennis players who have flown into Baltimore to BWI Airport, spent a week to 10 days with us, staying in a hotel and being treated every day. Complete resolution of their plantar fasciitis and their Achilles injuries. So yes, very effective for football players, baseball players, tennis players, and runners. Very, very effective. In fact, I don't know of any treatment more effective.
That was Dr. Terrance Baker. He has a clinic and works out of a hospital, and he has known PBM now for a very long time, and has introduced PBM to a lot of his patients. So pretty neat. The next section we're going to have is on dental health. So here we go. What kinds of things can PBM be beneficial for prior to the thing, or even to abscess teeth, to that area? What other areas of dental can light PBM therapy be useful for?
Oh, there are a lot of varieties of clinical applications in dentistry, as you do it in medical and veterinary medicine. In terms of PBM, from my field, I do a lot of preoperative. Before I take a wisdom tooth out for a patient, I would do a single application of photobiomodulation on the site of the treatment. I take the wisdom tooth out for the patient, and I do photobiomodulations after the surgery, and I close up, and then patient really has a lot of less pain and also edema after the surgical treatment. And also I do using the lymph node for lymphatic drainage. As we know, if you have any dental treatment as a work has been done, you will have a soft tissue swelling, and that is a part as a process of having any surgical removal of wisdom tooth or any tooth. So basically having a photobiomodulation extraoral to the lymphatic chain of the submandibular lymph nodes, that will help to really release the edema and increasing the circulation and then decreasing any postoperative edema. I use it for patients who are on bisphosphonate, which is, I'm not sure, which is, we know bisphosphonate is one of the medications that strengthen all the bones of the joint and everything, but really brittle the joint, the bone of the upper and lower jaw, with having what we call medication related to osteonecrosis of the jaw. So this is very important. So I do sessions before I take the tooth out for these patients, as well as subsequently to prevent any complications after the removal of a wisdom tooth for a patient taking bisphosphonate. So it is very using photobiomodulation to minimize the medication-related osteonecrosis of the jaw. So there are a lot of treatment that you can use it preoperatively as well as subsequently during perioperatively and after the treatment. That will help to really minimizing the postoperative complication.
Just some of the things I did in dentistry. Like I used to do a lot of surgery. I was in a small town outside Toronto. I did impacted wisdom teeth. I did very complicated surgery, stuff that would normally be done by oral surgeons in the city. I had no surgeons around. And when I do this, the last 20 years, I never wrote a single prescription for an opioid painkiller. It is that effective. It didn't matter how complex the surgery was. The patients really had pain that could be administered with usually some anti-inflammatories like NSAIDs, but really I never used opioids. And with this opioid crisis, that's huge. In fact, I did talk to the Oral Surgeons Association talking about this. Basically, all I do is I take the tooth out, shine the light inside of it. It's real simple that way. And actually, Tom, if there's any dentists on here, he has his units, but there also is, there's a dental attachment that goes with it.
Well, I was just looking for different modalities. I always look for different ways of helping people, and just through the internet. And randomly, I came across, SunPowerLED, and I started looking at the videos, and I got my first unit and tried it out, and it worked. There was no question about it. It helped, and I got a great deal of help from Dr. Mel Birchman's video and Dr. Gerry Ross.
Excellent.
As protocols on how to use it, especially even in endodontics on my patients. So
and what's the benefit? What's the benefit to the patient?
How about almost no pain and no swelling? When you're going to come to the dentist, and the first question is, "Is this going to hurt?" Is this going to hurt? No, I want to make it better, so it doesn't hurt. And it's before I even touch them or before I do anything, I just hit them with the red light, or I hit them with the 1050 wavelength if I have to go deeper. And there's a protocol you follow as far as the lymphatics go, where you have to increase circulation, submandibular. Right. For those professionals out there, there's a certain protocol we have to follow first to help with circulation, and then we help with inflammation. And at the higher level, we help with pain control. So a lot of them their pain is reduced to the point where they go, well, do I still need treatment? They question because their pain is gone. And I go, no, this is just temporary. You have an active infection. We got to take care of that and everything like that. So it's patient satisfaction. So they go out and tell everybody, how great it is. Everybody has a fear of root canals, and all of a sudden they don't have fear anymore. They say that they say it's that's hurt less than getting my teeth cleaned. So that's the best compliment you can get. So you make them feel better. You take away their pain. You reduce their swelling, and then healing is dramatically accelerated. Yeah. So I bring them back, for a couple days post-op, just for 10 minutes, just to apply, the therapy to them, the light therapy. And when they say I have no more pain at all, they're dismissed.
Right.
Now, I'm anxious to see how healing takes place. I'm going to bring them back. I've only had the units about three months. Actually, I have two. I will be getting a third, probably tonight or tomorrow. I'll be ordering a third.
Well, we'll get you the extra discount there.
I'm going to get a third. I have somebody who is actually my attorney friend who has a temporalis tendinitis, which is the muscle on the temporalis muscle is here. It attaches to what's called the coronoid process on the mandible. And he has pain on opening, he has pain when he touches. And he went for a consult to an oral surgeon who wants to do a surgical procedure on him. And I said, time out. Before you do that, I'm gonna go over there, hopefully Thursday. And I'm gonna give him his first treatment on Thursday. But what happens is, whoever I use it, they go like, I got to get one of these units. I got to get something. So it's because results are the best. Demonstration and results are the best. Mm-hmm. You watch the testimonials and they're great, but the people who actually are doing them are the happiest because mm-hmm. they got the reward. They got the results.
Yep. And
my
landlord, I'll just interrupt here for a sec. My landlord, they bought units, and then their friends bought units, and I ended up doing a home delivery of two of the units to them, and the one their friend Judy she's looking at the sheet that I give out that explains all the different uses of the light, and she says dental pain. She says, this can help on dental pain, and I says, yeah. And she says, how does that work? I says, well, you just hold the light like this. And she held the light there, and I just said, just hold it there for a while and see how that goes, and we were talking. And I think it was about 6-7 minutes. I wasn't timing it. But all of a sudden she says, I have no more pain. She says, I was going to take Tylenol because it was throbbing and I have no pain in there. And my landlord says, come on, Judy, you don't have to say anything like that, like he was just like, this is not real, she was just having fun. She says, no, my pain is gone. It was
and it's true. But you have also made an attachment that fits on the front.
Has Dr. Gerry seen any cure of gum infection using these lights?
Yes, actually there's some studies that just using PBM, where it actually is extremely effective, is surgical lasers as well as PBM. So what you want to get, again, it's actually a lymphatic system. So depending what's going on, I can help you. But there's, as I say, gum disease, we got a whole broad range of what's going on and how serious it is. But I mean, it was an adjunct that I used. Every single patient that had any gum problems, I used the light with it. In fact, when I talk, there's some studies happening now. Gum disease used to be thought as a bacterial disease. Now the new studies are gum disease is an autoimmune disease, like rheumatoid arthritis, like lupus. So what happens is the bacteria, you're allergic. Everybody doesn't get gum disease. The sensitive people get the gum disease, and they get the reaction to the bacteria. The body then releases the toxins that break down the bone. So that's why PBM is extremely effective, because now you're dealing with an immune reaction.
I do have a question. The question came in, if this can help with treatment of the gums, can it actually have a benefit to the teeth as well? And periodontal disease is questioned about.
Yeah, so I didn't know what the audience makeup was, so I left out all the dental stuff. Most of our research is actually focused on dentine. And we have actually shown in our research in the lab that you can stimulate the dental stem cells inside the pulp to reform dentine, potentially preventing the need for a root canal. So there are actually studies in that space, as well as for bone healing, around regeneration and periodontal defects.
Recommended procedure for surgical third molar extractions, pre-op and post-op.
Okay, very real simple. And bottom line, I do this day in and day out with it. What you want to do is, first thing, now, I don't know, this is before you go and have the surgery. The day before the surgery, the morning of the surgery, you want to treat the lymphatics. And if need be, I'll send a diagram where they are to you. And then you also want to put it over top of where the surgery is going to be done. So do that the day before, in the morning before the surgery. Now, if the dentist is really nice to you, what I would ask him to do is, when he takes the teeth out, before he stitches it up, you want to hold it inside where the extraction was done. And usually your lower molars have 2 roots, your upper have 3. You want to go 16 jewels down each of the roots. And then he can stitch it up. And then what you want to do after he stitches it up, you want to do 4 jewels, so 16 jewels with the red. Very important, it's the red. Or sorry, no, the infrared for the extraction. Then when he stitches it up, it's the red. Because as we said earlier, red's absorbed by the blood. So if you shine red, it's not going to go down to the bone. And you can reduce your swelling by about 75%, and you can reduce your post-op pain by 90%. So
Well,
again, I'll give you the full protocols if you write to me, and I'll send diagrams. And
yeah, with all my kids, well, my kids and my their mates, they have had, a number of them have had wisdom teeth removed, and they never needed any painkillers. They did the light treatment as soon as they did things, and even anytime the pain would start coming back, they'd right away use the light again, and pain would be gone.
So a couple of things there from some of the videos is the use for the light for the dental pain, for speeding up the healing when it comes to issues inside the mouth. But also when we were talking about the cognitive, our helmet is this one here. And it has the 2 wavelengths, the 660 and the 810 nanometer. That is our regular helmet. And this just comes down on top of the head like that. And we have the 660 810, and on special order, we have the 660 1050 nanometer. But that's the one that Alan McGraw was using, the fellow with the Lewy body dementia, and also for Parkinson's and that. So we've seen some really good results. By the way, in the beginning of the video, I mentioned about the first video that you watched. It mentioned about the Ultimate being the most powerful device that we have. Well, as a matter of fact, we have one that's very, very similar in power, which is the Super Palm 1050. And because that video is a little older, we didn't have this device yet. But this device is similar to the Ultimate, with the same amount of optical power in the 660 nanometer. And then we have what's called the 1050 nanometer wavelength instead of the 810. And this is totally invisible, this here, but you can actually see it in the video. It looks a little purplish. That is the 1050 nanometer wavelength. So that is a wavelength that has the potential, because it's a little bit longer, to go possibly a little bit deeper as well. There's all other effects that we've seen. There's some newer research around the whole area of structured water. Now, the next video I want to bring up is just mentioning about combination therapies when you're talking about using red light. Like specifically, it has to be 660 nanometer red, which is this wavelength here that we have in all our devices, and a compound called methylene blue. The two of them work extremely well together. And if you want to look up www.methyleneblue.red, not .com, .red, put the methyleneblue.red. And check that out because there's a lot of cool information there on that website. So now what we're going to do is I'm going to play a video, just a short one, of a very well-known individual. He has a large audience and podcast, and he's been around. His name is Chase Hughes. So you can have a listen how in this case with Chase, he had seizures, and he actually did a lot of different things, but one of the things he did is he introduced he ended up using our helmet. If you watch, there's just a brief shot there, and he was introduced by a doctor in Florida, Dr. John Lawrence, about our helmet with methylene blue. And if you, so we're going to play the video now, and we won't carry it right to the end. We're just going to play a few minutes of it, and that video is also on our YouTube channel. Do check out at SunPowerLED on our YouTube channel. There's a lot of very good videos there. Dr. Mark Cronshaw is a newer one that will be coming up any day. We have one from a while ago, but there's some new interviews. Make sure you get a chance to watch the new ones with Ari Witten and Dr. Mark Cronshaw. Earlier you saw in one of the videos from the researcher from University of Buffalo, and that was Dr. Praveen Arany. Great researcher, has done tremendous work over the years, and he was talking there about how certain mechanisms about PBM. But we have all these videos in our past videos. Please go there to watch it, either past videos. Also, for those that are involved and want to dig into research, if you go to the research tab on our website, go down on the research tab, you can find a lot of different things. As a matter of fact, if you go to PBM 2024, that is the event that I went to, a worldwide conference on photobiomodulation in England back last year. And it was really neat to be able to meet Dr. Margaret Naser there in person. And she presented on my behalf the one case study on the concussion that we had with a young boy. And that's also on our website. But if you go to PBM 2024, you can click on on the PBM 2024 box. Click on there. You can look at her study more in depth, as well as Jennifer Flora from West Virginia. So here we go with we'll just play about 5 minutes of Chase Hughes here.
This is the inside of my brain. And this is a blue substance which might have saved my life. And I'm going to show you how all this happened and how it might save the life of somebody that you know. 9 months ago, my brain was eating itself alive, and I was having about 9 seizures a day. There were periods I didn't even know who my wife was. This is my family. And this is my new daughter, Hanna. She is 7 months old now. Hanna was born on Christmas Eve in 2023. My memory was failing so fast that I slipped into a depression. I cried when no one was around, just realizing that if this kept going, my own family would become strangers that I didn't recognize. And the seizures almost always came with a huge dose of amnesia. So I wasn't fully aware that I was having them. And I find out later that people had been seeing me have these seizures for about 3 years. And I'd been studying neuroscience and neuroendocrinology for years, so my family assumed I would know if something was wrong. I was diagnosed with temporal lobe epilepsy with a possibility of something else called mesial temporal sclerosis. And when this happened, I got prescribed a drug to treat the symptoms, to stop me from having seizures. And I asked about drugs that could reverse the damage to my brain or drugs that could stop the underlying cause of the seizures. And I got nothing. The prescription I was given had a long list of side effects, but the most common side effect of that prescription was seizures, actual seizures. I was desperate and scared and spent some time crying and praying to God to help me with all of this. And I read through about 1,000 research papers. I watched 100 videos on brain health and ways that we could potentially stop what's going on and hopefully reverse all the crap that was happening. And in the midst of all of this, I'm terrified. I won't be able to work or support my family. I'm setting up life insurance. I had no idea who's going to feed my kids and take care of my family if my brain keeps just essentially eating itself. There was no way to tell if my brain was about to collapse like some Jenga tower. And during all this, I'm having to still be on TV, film YouTube videos, and essentially just pretend like everything is totally fine. So later, I'm on a plane to Los Angeles. About a week later, I'm scrolling through YouTube shorts about brain health. And this doctor comes up talking about neurology, who sounded like a California surfer dude. So I kind of dismissed it. I swiped it up to go to the next video. But then I processed right then what he was saying, what I just heard. He was talking about mitochondria, the very thing that I was looking to fix inside of my brain. So I tried to swipe back and I hit the home button on accident. And obviously you can't go back if you're swiping. It took me 2 days to find out who this doctor was after not being able to get back to that video.
Sometimes mitochondria can be like an old car where it's producing way too much oxidation, and this would be like a dysfunctional mitochondria.
Meet Dr. John Terrance. He is the guy from the video that I could not find. When I tracked him down on YouTube, he was talking about this stuff called methylene blue. And he was saying all this incredible stuff that made me think, if this stuff is so powerful, why don't we hear about it? Why didn't my doctor tell me about it? Why isn't everyone taking this? And I start hearing this unbelievable stuff about methylene blue. I genuinely can't believe. And it's literally a blue dye that was created in the 1800s to dye fabrics. I was hearing it was the magic bullet of medicine. In fact, I learned that the term magic bullet was first spoken in history to describe methylene blue, and it's been used to treat disease since about 1890. And if you look it up, you're going to really find out why they call it a magic bullet. But at this point, if you don't know what mitochondria are, let me give you a super basic rundown. So mitochondria are little microscopic power plants inside of every cell in your body, and they're responsible for generating electricity that fuels every single function of the body. And these little organelles are absolutely crucial to our health because they convert nutrients into ATP. This is the energy that powers everything in your body, from muscle movement to activity up in your brain. And almost every chronic disease, from like diabetes to neurodegenerative disorders, can trace its roots back to mitochondrial dysfunction. But mitochondria is also the beginning of health. All right, so let's go back to Dr. John Terrance. I've been watching this guy on YouTube now daily to learn about the brain and methylene blue and melatonin and even red light therapy. And I decided to track him down, and we started texting a lot. I invited him to talk to my VIP clients that I coach every week about these incredible molecules. And then I just decided to go see Dr. John at his clinic in Sarasota. And I thank God that I did. It's the middle of August, and I'm supposed to have an appointment today with Dr. John Terrance. It's taken a while to get an appointment. He sees a lot of people, and my appointment is in like 20 minutes from right now, and I'm going to take you in there with me. I'm not sure what to expect. He is a chiropractor. He is a neurologist. He's got a lot of stuff under his belt, and he does some alternative approaches to brain stuff. We'll see what happens.
Just give me some history. How did this all start?
So this condition, as far as I know, started 2019, but I was sitting in front of my parents and I just blacked out for like a minute and a half. I had amnesia for that event, and then I had another 100 more over the next year. And my girlfriend at the time, who's now my wife, so she knew that I had postgraduate certifications in neuroendocrinology and medical neuroscience and radiology and all this stuff. So she assumed that I would go see a doctor, but I didn't remember any of it. In 2022, I recorded it on video and I was able to watch it, and I said, I have temporal lobe epilepsy. So I'm thinking maybe the origin of some of this is head trauma.
Yeah.
So I've done 9 deployments.
Okay.
Explosions, all that kind of stuff. I don't have any front teeth in the top left. These are all fake.
Is the bridge straight across the midline?
Mm-hmm. I think so.
Broken nose. I can see your nose still
A few times.
How's your breathing through the nose? That feel restricted?
I can only breathe out of one nostril.
Which one?
This one here. The right side.
So this is what's really interesting, and I get into depth in my my endonasal book about like what happens because your parasympathetic nervous system is going to be more run by the right brain, right? So the left nostril is going to be more parasympathetic. So if you're not breathing and that air isn't going through there, you're not activating different systems that are going to keep your autonomic nervous system running, which is going to be like, you know, perfusing the brain. Because so what concerns me, so this is supposed to move, you never cross the midline.
Wow.
So literally, so we may see some really positive changes with you, even with this apparatus in here, but then you might not hold on to it. And it might not be until we get this
split.
So it can move. Tongue way out, look down to your right, stretch the eyes down to the right. Okay, good. Beautiful. Beautiful. A deep breath in the nose. Notice all that space that's opened up.
Oh, yeah. So all this stuff I would have scoffed at was actually proven science, and they don't teach this stuff in medical school. I learned more about my brain health than I thought was even possible. And I got really seriously introduced to the proven power of red light therapy and how red light gets absorbed and then used by methylene blue in our bodies. And it's proven to help with everything from pain and inflammation to dementia and brain issues and even hair loss. And I'm actually embarrassed to say that I thought all this was fringe science.
Okay. So, I got to know Dr. John Lawrence, but visited him at his clinic. And it's pretty neat that Chase was able to be helped with Dr. Lawrence's treatments, including our SunPowerLED helmet. So he's done. There's more video on him on our YouTube. Just tells about his improvement, dramatic improvement in his life. And I believe we played a part of that, and also the methylene blue had a part of that. So I will go to a few questions. We won't carry it on too much longer, but we've got a lot of questions that have popped up. Michael's asking, is there a clinical trial one or two? We would love to get some clinical trials going. So if there is anyone with a rather large wallet, because if you were to try and do this in North America, in another company that I'm working with, we're looking at a CRO, that's clinical research organization, costs about $20,000 to $30,000 per patient to run a trial. So if you run a trial of 10 people, that's $300,000. But guess what? A trial of 10 doesn't, in the medical realm, does not mean anything according to those out there. Even though we could have people like Chase Hughes, 5 people like Chase Hughes turn right around, they will not believe that it could be any good until there's a full trial with a double-blind study. So anyways, that's the unfortunate thing about that. Kale is talking about us having a severe stroke last year. And it's very possible. We've had good results with our device for strokes. So we've got a couple cases, but one in particular that I can mention is one friend of mine who had a stroke and for 2 months could not speak clearly. And we did one treatment. So he couldn't speak clearly. You could not understand him on the phone. And the very next day, he was able to speak clearly. We had another person in the States, 20 years not being able to speak clearly, one treatment, and there was a significant improvement. Now, unfortunately, sometimes people will, as Dr. Margaret Naser points out, they will need to continue the treatment to help with their brain health. Everybody is quite different and depends on the type of condition that's set in. So thank you, Fernanda, for asking. So for maintenance, how many times per week or month do people need to have a treatment? Really, it depends. Again, it comes back to the condition. Some people maybe twice a week. We had, just to give you an example, the opiate addiction and depression study that was done in West Virginia at Shepherd's University. They only treated twice a week with our helmet for 3 minutes. 3 minutes a session, so 6 minutes per week. And after 2 months, significant improvement in their situation. So it can be quite amazing. And even with autism, and I welcome anybody out there that has a kid with autism and would like to try out the light. Just contact us, and we'll see what could possibly happen. In about 3 weeks, I'm going to be in San Diego at an autism conference, and there's research out there about the effects on autism. So yeah, it's beautiful. So with the helmet, we're looking at things that can help with strokes, dementia, Parkinson's, brain fog. I'm just trying to think of some others, brain fog, concussions. There's quite a few different cognitive things anyways that the helmet can help with. Okay, let's see. I'll go to the next question. Plantar fasciitis from the bottom of the foot. The question comes from Kim. Thank you, Kim, for your question. So I would suggest you're looking at about 2 minutes of the red. And I'll just show you something about the red light. Look at the pen. Oops, just 1 second, and turning off the other lighting so you can see this. Look at how the light is going right through my hand here. I don't need that's right too. I don't need to shield it because so you can see it going. Now, if I did it on the 1050, and you wouldn't be able to see it, but it is just streaming through the hand. But our eyes just can't perceive it. So, yeah. So 1 minute, 2 minutes of the red, about 4 minutes of the near infrared. And try and do it, even if you've got a unit, try and do it 3 times a day. That'll be amazing. If you've got to go to a clinic, 2 or 3 treatments a week, and you'll still see improvement. But how much better could it be if you can get on it daily? And I do say, like, we've seen some people respond very, very quickly if they have one at home and they do it more than just once a day. So good. Let's see. Susan is asking, what about the strokes? And again, it's really cool that the light can actually, after the event, that the light can actually help with different, to try and heal the brain. We've, just on another note,
hematomas on other parts of the body, we've been able to see how fast they've been able to heal. Yeah, so, okay, let's see, another. Okay, so Dr. Jamal talks about my wife has been treated with methylene blue and PBM with chiropractic treatment for a severely torn shoulder labrum, bursitis, and 2 full thicknesses rotator cuff tears. Excellent results. Thank you for your feedback on that. And Dr. Jamal has one of our units. So can this be helpful for brain health? This is from Jennifer. Thank you, Jennifer, for your question. In general, this is able to help with brain health, and you can, because the light can penetrate the skull, and we demonstrate that on one of our other things, but on one of our other webinars, but the light can go right through, and that's going to increase the amount of blood flow just on the inside wall of the brain with, let's say, the 660 and 660, and then 810 can even penetrate deeper into the brain. Okay, Chris is asking, hi, Tom, can you use PBM to eradicate a root canal infection? So as Dr. Ross pointed out, that he's been able to see this help some of the abscesses. So yes, and this is, obviously it's very, very important to get rid of any type of infection. So work closely with your dentist on this, but it's beautiful. So Crystal's asking, how do you use methylene blue and red light therapy together? Basically, you can take it orally. It's something that can be taken orally, but again, check with those that are in the know. Plus, there's quite a bit of information. Do your own research, and there's quite a bit of information on that website. Okay. Susan asking, what is the advantage of having a helmet with 1050? There seems to be, we were at a show recently and we treated a lot of people for with the super helmet, and we also treated, it was a lineup of people kind of that wanted to try the helmet at this one event. Like we just kept treating one after another. People are saying, well, when's that person finished? Well, 4 minutes, and it just kept going. So anyways, the people that got treated with a 1050 seemed to us, especially my son-in-law, who hasn't seen really this kind of thing before, but quite a number of people just yawned, and they just were like really relaxed coming out of the usage of the super helmet. So I'm not sure exactly the mechanisms. And we're going to just say that anybody who has attended this along, you definitely will be entered in as a ballot for today. You don't have to watch to the very end. Well, I think I'll take another couple more minutes and then we'll call quits here or another minute or two. Fernanda's asking, have you seen this help with hand shaking in teenagers affected by traumatic brain injuries? Well, matter of fact, traumatic brain injury is something that Dr. Margaret Naser, who was on the video earlier, did research on. So you can, if you email us at info@SunPowerLED, please go there and we can forward your question along. And let's see. So, okay, yes. So Deanna's sorry, it just skipped on me. Sally's asking, I had a total knee replacement 10 months ago. My scarring ended up with keloids. Yeah, that's really tough. So ideally, Sally, it would have been, hindsight is always great, right? Looking back and saying, if only. But even now, you could help improve probably your range of motion. So definitely something that can help your knee healing progress. And so definitely check this out. I'm going to call it good quits at this point, but definitely good hydration with water is very, very helpful. And so when you do light therapy, do add water before and after. It's a good thing to do. And as Gerry Ross was talking about, also draining of the lymphatic system. There's a diagram on our website so you can learn about the lymphatic system. So definitely, look at the lymphatic system for helping to get rid of inflammation in your treatments as well. Okay, well, I want to thank everyone for joining us. Please join us next Tuesday. And and I wish all of you God's richest blessings. All the best. Have a good week. Bye for now.